Hi guys, Reform UK certainly aren't sending their best. So one of their MPs appeared on the Politics Live show for some reason to complain about how much the NHS is spending on translators. So he clashed with Ash Sarkar from Novara Media on this topic, where she explained to him that services like translations exist so that patients can access the healthcare they need. But Rupert here said that people should speak English because this is England, not understanding or pretending not to understand the problem with such a statement. Have a listen to this.
So the first thing is that when it comes to things like translations, that's so patients can access healthcare. It's the job of the NHS.
If they can't speak English, Ash, they should.
Wait. Did I interrupt you? Rupert, did I interrupt you? No, I didn't.
I'm sorry, we don't need
translation.
No.
Wait. Let me finish, all right? The NHS exists to provide the best possible care to patients. Now, some of those patients will feel more comfortable speaking in their native language.
I don't care.
Right?
I have no interest in that.
Well, fine. They
should speak English. They live in England, they should speak English.
Doctors take an oath to give whatever patient comes to their door the best possible quality of care. That is going to involve some translation services. When it comes to things like DEI, I'm sorry, you are picking the things which play to your base. That's your job as a politician.
Waste of money.
That is your job as a politician. That is not where the problem is. The problem is that we've had 14 years of austerity. The country has become less healthy, measurably less healthy. It's become poorer. The Michael Marmot report laid this out. The most deprived regions are also the most unhealthy. They're the most impacted by austerity.
Well, you're certainly right on that. You're certainly right on that.
All
right, well, let's have a look.
Okay, so of course he's playing to the base. He's playing to Reform UK supporters who think, oh, look, oh my goodness, we're spending all this money on translators. Well, if you come to Britain, you have to speak English. See, there are a number of problems with this. First of all, as Ash has pointed out, the NHS is there to provide a service to people. So these people, in many cases, are already paying taxes, so they deserve to have a service provided to them. But there's another problem. If people are not able to explain to the doctor, the nurse, the condition that they have, if they're not able to explain it because they can't speak English, then what's going to happen? That condition is likely to get worse. And then it's going to become much more expensive than a frigging translator. It also relates to people who are maybe off sick. They're not able to work. If they're not able to explain to the doctor the condition they have, they may get the wrong treatment or they may not get any treatment at all. And then it becomes a bigger problem for the NHS. Now, we're talking about people who are already in the country. So you have to be pragmatic about this. See, Reform UK talking about, well, we'll just stop providing these services and to hell with the consequences. As I pointed out, it would be more expensive in the long run. These people complain about a cost. Well, the cost will be much greater in the long run if you have people who are not getting the treatment they need and those conditions become chronic or worse. So it's cheaper to provide people with the services they need as soon as possible. And, if people are off work, then this is damaging the economy as well. See, this plays to the racist, xenophobic base of Reform UK. Look at all this money we're spending on translators, let's cut it out and we save this money. Ignoring the reality that these people are already in the country. Some of them are working, so they deserve the support they need. And of course, GPs and doctors have an obligation to try and help people, to save lives, to improve people's health. And if they're not able to communicate correctly to people, then you're going to have problems down the road. As I said at the beginning, Reform UK are not sending their best. Either Rupert here doesn't understand these things, or worse, he's pretending not to, because he knows the average person on the street hates the idea of spending money on translators. You're in this country, you learn the language. But we're not talking about accessing, a fun fair. We're talking about accessing health services. Because if people cannot access the healthcare they need, it's going to create problems for them, problems for society, and of course, a bigger bill for the NHS. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.